Hello everyone, welcome back to the Hematology series. Today we'll be learning about Polycythemia Vera. In the next slide, I have a few questions for you to attempt and have a go at before we'll go through the answers in about a minute's time. Okay, 1. What is polycythemia? Polycythemia is an excess cell proliferation of hematopoietic stem cells, which leads to the excess production of red blood cells and an increased red blood cell mass, as well as an increased production of neutrophils and platelets. 2. Causes. Polycythemia is caused by a mutation in the JAK2 gene. 3. Risk factors. Due to the buildup and increase in red blood cells, polycythemia increases the risk of blood clots, and therefore DVT, deep vein thrombosis, and PE, pulmonary embolism, is an increased risk factor for patients with polycythemia. 4. Patients with polycythemia can present with bruising, dizziness, as well as pleuritis. This is just due to the increased release of histamines, especially after a hot shower or bath. This can be prevalent. There can also be congestion of the red blood cells, especially and particularly in the spleen and liver, which can lead to splenomegaly and hepatomegaly. 5. Budd-Chiari syndrome is a risk factor for patients with polycythemia. 6. We can investigate polycythemia in 2 ways. The first is genetic testing, looking for the JAK2 mutation, and the second is checking for a high hematocrit count. 7. Management. We would want to decrease the risk of blood clots in patients with polycythemia, and therefore aspirin would be a good drug choice for patients with polycythemia. We would also give venesection as first-line treatment, as well as hydroxyurea for those with a slightly increased risk of secondary leukemias. I hope you were able to answer those questions and hope they were able to stimulate and challenge you. If you have any questions, please comment down in the comment below, and see you next time.